All right, good evening, everyone, and thank you for coming. We appreciate you coming to our 4th annual town hall. My name is Michelle Miller, and I'm with Human Services here in Martin County, and we are here to support you all in highlighting the opioid issue that's going on in Martin County. And we thank you all for coming. This year is going to be a little different. We're going to switch a little bit. In the past, we've talked about opioid use and how it's related to prescription pills. This year, we're going to pivot a little bit and talk more about fentanyl and how we've seen that change in the landscape over the past year or two. And I appreciate that you're all going to be bringing your unique perspective to this issue. And I want to thank you all for coming. I want to thank our moderator, Micah Robbins, for coming and doing this for the 4th year now. And last but not least, I just want you to know that if you're watching and you want resources, please go to the county's website and put in opioids, and it will bring up a list of resources that are available to the community. Thank you, and we look forward to hearing from you all tonight.
Well, good evening, esteemed panel, and good evening to Martin County. This is our 4th annual opioid town hall meeting. It's good to have a live audience here with us as well. We made that pivot with COVID. I know, that quaint thing called COVID all those years ago. My name is Micah Robbins, and for the last time tonight, I will be signing on from the Palm Beach County Behavioral Health Coalition. As I move on to other things moving ahead, I'm not going anywhere, though, so I look forward to being here for the 5th annual Opioid Town Hall next year. I'm a resident of Hope Sound right here in Martin County. And this forum, we bring together the experts and those in the field when it comes to the opioid crisis. And it's been an evolving crisis, as we all know. And so tonight, for the community, it's a great chance to give some updates, look at some of the successes that we have been building on here in Martin County, also looking at what are some emerging issues and what we're going to be doing about that in the future. Also, for people to know, too, this day is significant in that it is National Overdose Awareness Day, which also is a precursor to National Recovery Month, which starts tomorrow, which runs the month of September. So there have been multiple events throughout Florida today, especially here in South Florida, looking at overdose. This is really kind of the more somber of the day, as we have a lot of remembrance for those we've lost in this crisis. But thank goodness for the work that everybody here on this panel has done. There has been light at the end of the tunnel. I'm not saying it's all good news, but for those of us who are working in this space, we've gone from, let's just say it's gone from horrific to horrible, which is good. We've had progress. We're saving lives. And it's because of what everyone here is doing. There is progress, but there's more to come. So welcome, everybody. I'm going to introduce the panel, and then we're going to start firing off some questions for you. Also, for the panel, if you hear a question directed to one of the individuals, but you have some further feedback or would like to participate in that dialogue, please do. These microphones do work. They work great, and the information you bring is critical. So I will start with a longtime veteran of this panel, and thank goodness, Chris Camel is here from Bureau Chief. Oh my gosh, you get a new title from last year. This is still okay. From Fire Rescue, Martin County Fire Rescue. They are on the front lines of this and have been incredible leaders in not only life-saving, but also in the usage of naloxone and other products to really make a difference in what's happening. Great to have you again here, Chris. Dr. Kuchera. Dr. Jay Kuchera is a pain specialist, and he is also a leader in looking at what not only the opioid crisis means, but really a lot of the origins, a lot of the emergence, and a lot of what's to come. He sits on numerous panels, numerous advisory committees across the state and the country. We're fortunate that he practices and works here in Martin County, but his influence is broad and wide, and not only the information he brings. So welcome, Dr. Kuchera, again. Also plays a mean guitar, just so you know. Sergeant Michael McCarthy, thank you so much for joining us from Martin County Sheriff's Office from the Narcotics Unit, and I know you stepped in to fill in tonight. We appreciate you coming in on that last minute, but also coming from your unit. Looking forward to hearing everything that you're doing. For those in the know, Martin County Sheriff's Office has been very progressive in their handling of this issue, from not only gaining resources for those in need, but also having great communication with those that provide a number of different services around the county. So as I'm talking, you can kind of start hearing in my voice that the coordinated efforts that are happening in Martin County are really being effective. Sheila Furley, with so many initials after her name, there's more than in her name. But she's an outpatient therapist, which is wonderful. And for those from New Horizons to the Treasure Coast, New Horizons is one of our publicly funded inpatient and outpatient centers where a number of the individuals in our community go to seek treatment and support, both inpatient and outpatient. They're a tremendous resource. And as we talk about resources in the community, that's one of the major ones when we say, hey, we have support here in Martin County and the Treasure Coast. New Horizons is that facility. Thank you for being here, Shirley. And Eric Schulmeister. This is a cool story. So for those that are in this space, and our friends in law enforcement are the first to say this, when it comes to the opioid epidemic, when it comes to our substance epidemic, this is not an issue that we arrest our way out of. That's not the goal of law enforcement in this. We want to see individuals get help. People suffering from the disease of addiction and other behavioral health needs need caring, support, and resources. One of those resources we have in Martin County is our drug court system. Drug court is an opportunity to look at adjudication through the lens of the individual and try to meet their needs as best as possible and give them the tools and the ability to, yes, maybe they have to stand for what they may have done, but they know that the individual has so much more to offer, and let's move them down the path of recovery. So, Eric, it is a pleasure to have you here tonight, and welcome.
Thank you.
So, first question, I always open with Chris. So, our chief, looking at this past year, just wanted to get the overall, give the community the understanding of sort of the environment that you're looking in and you're working in, some of the feedback of this year, your work, and maybe some changes you've seen within this crisis from your perspective.
Well, from 2021 to 2022, we saw about a 30% decrease from year to date. And if you look at our numbers for this year, there's a number, it went up by 3. So last year was 96, 99 thus far. That's actual doses of Narcan given. Now, if you break that all down, the ones that are actually overdoses is a little bit less because sometimes it's given prophylactically to make sure it's not a narcotic issue. So you look at those numbers, we're almost exactly what we had last year. So it's kind of become, I guess you could call it status quo. It's not decreasing, it's not going up. We've made a lot of progress, but we're at a point where it's a little bit stagnated, and we're hoping to move forward with some improvements in the future.
And I think for people to understand, too, that improvement, even though that number, say, hasn't moved, it's sort of plateaued against the backdrop of what the substances we're facing now. That actually shows a lot of progress.
It's a huge amount of progress, especially early on there was a lot of pills and what have you that were part of the issue with OxyContin and whatnot. Then fentanyl really became a big thing in 2017 and 18, and the numbers skyrocketed. And since then it's been pretty steady, and we've hit that lower plateau, which just means there's more work to do.
But it's also your team is trained in so many different ways now to address this.
Absolutely.
And what are some of the new techniques or things, we know naloxone certainly, but are there any other rescue techniques that are out there that your team is using that you're finding effective?
One of the big changes that's coming down the line is ensuring that the way we treat somebody that we encounter who's completely unconscious and barely breathing, we're going to titrate how we give the Narcan to their respirations. So the goal is not to wake them up. The goal is to increase the respirations to where it's sustainable and hopefully not wake them up fully until we get them to the hospital. That way we're not dosing them too high with Narcan and putting them in a state of withdrawal.
So, and that can happen certainly with naloxone usage. There's a lot of talk on increasing naloxone dosage, and I know you're looking at how do you titrate that appropriately. But for the public who may be just getting naloxone publicly and available to them, What are you seeing some of the dosage levels at? Because the products that are out there now are anything from 2 milligram to 8.
Right.
So could you give a little information on how that sort of is shaking out?
There was a time when this really first started hitting that we were taking 3-4 doses before somebody actually would regain consciousness. Since then, it's also plateaued and it's much more controlled. The problem that we sometimes run into is maybe a family member gives the intranasal Narcan, and then the sheriff's office shows up and sees it's not working. They give a dose, and then our crews show up, and it still hasn't quite gotten them to where we want them. So they start an IV and then give it IV, and then this patient's in a serious withdrawal issue. So a lot of what, like I said, the focus is changing that and trying to address that.
And this is for Dr. Kuchera, because we are seeing that those of us in the prevention field, we call it an arms race. With the rise of synthetics, you heard Michelle talk earlier about fentanyl, but fentanyl is sort of an overall name for this class of synthetic opioids. Could you give us some sort of current status of what's happening in the synthetic space right now?
Really hasn't changed a whole lot. I mean, the rough idea is that illicit chemists that are manufacturing these opioids, they try and stay ahead of the game. So when a class of opioid is targeted by DEA and there's legislation against it and so on and so forth, they come up with a different molecule. So fentanyl hit the market. Before that, it was some synthetics. Now, nitazene's been around for a few years. These drugs have been around for, some of them have been going back 20, 30, 40 years, and they cycle. They get put on the shelf, and they get pulled out. And then there's also some novel compounds that have been around. So it's a definite problem. It's a good thing that carfentanil is kind of faded away, and we're back to fentanyl. Carfentanil is extremely toxic, very bad. And now with the nitazenes and the synthetic opioids are always changing. It's the flavor of the month. They drift around. They have a certain life, and then they disappear, and another one comes in.
And I don't want people to get confused in this issue because you hear about designer drugs per se, and sometimes people equate those with more of the alpha PVPs and those types of things that would be hallucinogenic or those types of things. But even in this class of synthetic opiates, designer drugs just means someone's changing a chemical compound and recreating it. Are you seeing that, for example, nitazene and other things that are on the street right now? Are you seeing production, or are you seeing influence of these, like, call them designer synthetic opiates?
Production so the production mainly is offshore.
Correct.
I didn't quite understand.
As far as what is being, maybe what's being treated for, or what you're seeing, maybe through are we seeing increased usage of these?
Well, yeah, it's hard to find pure heroin. In fact, heroin up in the Northeast disappeared a while back, and most of the supply is fentanyl. In fact, I heard a quote one time that it's a good day when you're doing heroin, just because heroin seems to be a little bit more forgiving, which is interesting because of, what we heard about the titration of naloxone. If you get these really very potent, high affinity, these synthetics that really stick to brain and work very quickly, it seems like it'll give you guys a run for your money with the naloxone. But we're seeing mainly synthetics now. I mean, heroin is gone the way of the 8-track, just about.
It came from about the same era. So, actually, this is a great way to pivot to Sergeant McCarthy, because you sit on the narcotics division of the Martin County Sheriff's Office, and you're on the interdiction side as well as the support side. And what are you seeing within the law enforcement space?
So just year to date, in this year comparison to 2022, from January through August, we have so far about the same amount of overdose deaths. We haven't really seen any trend change. I think the interesting thing is in our total overdoses, January through August, last year we had 48, 17 of which were fentanyl related. This year we have 39, so we have a slight decrease. However, that number 17 went up to 26 being fentanyl related. We're seeing a lot less prescription pill usage and a lot more fentanyl usage due to the mere cost of it. Fentanyl is so much cheaper to get at the street level than prescription pills due to government intervention, programs to prevent prescription fraud. So we're seeing a lot more people pivoting over to fentanyl, unfortunately, which are having these effects.
And where are you seeing a lot of the acquisition of these illicit drugs? Are you seeing it through traditional drug distribution networks, illicit, of course, online? Is there any particular area that people need to be aware of?
So we do. We're getting into black web marketing of drugs. We have seen a lot more of that over the last 2 years. But traditionally, a lot of the individuals in Martin County that are suffering from addiction, it's a lot of it's coming from Palm Beach County, Broward County. It's moving up the thoroughfares of the Turnpike 95. And we don't see the same distribution here that we see there. But unfortunately, a lot of it's street level, and it's just a matter of taking a trip down to Palm Beach, a 30-minute drive, and then coming back up.
And I will say it's interesting because I do work across the region, and in Palm Beach County, very similar types of things we're seeing here. We've actually seen a 5% decrease in non-fatal overdose and an 8% decrease in fatal overdose. I think that's because they're moving the product north, it sounds like. But the other part is certainly widespread naloxone distribution and usage. But for those to understand, that seems like a very small number, but you look at the aggregate when you have, say, 560 overdose deaths in a county, that means there's about 30 more people that are still alive today because of those interventions. That's worth it, right? That's making a difference. So I think that ability to see those trends is part of the battle, right? And what about your work with, say, DEA and other national or state-level law enforcement and that network?
So right now, we're working a lot with FDLE, which is Florida Department of Law Enforcement. They're the statewide law enforcement agency. They actually, through some bills that Governor DeSantis signed, have a large funding available for fentanyl eradication. So they provide funding to us. It allows us to get equipment, hire overtime to help stem the flow of fentanyl from these larger counties up to our counties where it's affecting our citizens.
So the interdiction side is definitely being effective.
Oh, 100%. Yeah. I mean, with the use of technology, we have to grow, we have to learn. It's becoming a little more difficult. But luckily, on the judicial side, the state attorney's office is growing, learning, becoming more progressive with working with law enforcement, and then working with our federal partners in terms of interdicting them before they get to the United States is key as well.
And it seems like I was earlier sitting with DEA this morning, and even they're looking at not only their interdiction side and but also on the prevention side. They're getting engaged in the prevention side of the coin as well. So it seems like we're looking at this as a collective process now, as opposed to just dealing with crisis after crisis. And you're hearing it right here. It's becoming very effective. And I did want to move to Sheila, because one of the things, especially on the other side of this, is when someone chooses to get into recovery, they generally take a treatment path. And when you're in your practice, and certainly at New Horizons, are you seeing any different trend changes in the profile of clients that are coming in, especially either co-occurring, those types of things that are happening these days?
There's always been a good amount of co-occurring, so that hasn't changed that much. We're getting, the challenge is sometimes people are getting mental health diagnoses that stay with them their whole life, rather than, we try to treat people for a while, get them through those initial weeks and months, because often their withdrawal, their early recovery behaviors, et cetera, mimic mental health symptoms, but they really don't have that mental health condition. That's what I see some, and so, but No real difference.
Now, as far as treating for opioid use disorder versus other substances that present in a primary, are you seeing, as you're hearing, is there a leveling off of that? Are you seeing an increase, decrease? What are you seeing coming through New Horizons?
I actually, we're seeing increase. And, yeah, we have a therapist specifically for the people who are on Suboxone for opioid addiction. And she's full all the time. So we're not seeing it change for the better, unfortunately.
But are you seeing any other substance trends? For example, are you seeing any rise of, say, THC or other things like that? I know this is an opioid town hall, but we look at the big picture as well. But are there any other emerging issues you're seeing coming through in the treatment area?
No, not really. No, I'm not seeing anything really different. People coming in are getting younger, which that's a positive sign. But that's about the only change that I've seen.
And if you say younger, are you talking, say, under 40, under 30, or are you talking like young people, like, late teens, early adulthood?
There's a lot more young adults and 20s than I've seen in years past. Big difference, big difference. I'm not sure if that's connected to DCF getting involved sooner. I don't know. I can't say what the reason is, but definitely seeing a lot of people younger without kids. I'm much more used to working with middle-aged and older people. And so that's definitely a new trend. And it's encouraging to me because rather than decades, it's a year or 2 or 3. So I feel like we're making a lot of progress that way, getting to people sooner.
And Eric, I'm going to get to you in just a second because I got a bunch. But I wanted to get to Dr. Kuchera really quick so the public understands this idea of as Suboxone brand name, but buprenorphine treatment, and that's really been quite a bridge for a lot of folks, especially with opiates, that you can have that transition, if you will, to successful recovery with a medicated support. And Jay, I was wondering if you could, Dr. Jay, if you could explain a little bit of what is buprenorphine and what does it do? And when someone says MAT, I know there's different nomenclature around there, but it kind of explain that a little bit so people understand what we're talking about when we talk about buprenorphine.
Yeah, that's such a can of worms there. In fact, just today I was having a conversation where one of the complaints is that buprenorphine, which we use to treat opioid dependence and opioid disorder, opioid addiction, is an opioid. If you look at the molecule, if you had a picture of buprenorphine and oxycodone and morphine and heroin, they all look very similar. It's kind of like Camaro and a Firebird. They're very close. And they just have a couple little extra bells and whistles on it. But there are some differences in the way buprenorphine behaves, which is Suboxone, and it's also several other medications now. So we have injectable buprenorphine. If I started running through all the different brand names, there's more than a half dozen right now. But so if you hear the word buprenorphine, think Suboxone. Suboxone is buprenorphine and naloxone together, but that's maybe a little too detailed. So the situation with buprenorphine versus like oxycodone or Percocet or Dilaudid, which is hydromorphone, buprenorphine, the molecule wants to park and stay in the brain on the receptor longer. It dwells for a longer time. It has a longer life in the body. So rather than if somebody's doing Dilaudid, hydromorphone, the levels of the Dilaudid in their blood just go up and down, and that is what we call reinforcing. So that causes the reward system in the brain, it's pleasurable for that cycling. Buprenorphine and methadone have they just kind of just sit around for a long while. And so that rush, if you will, that experience in brain that produces these chemicals that are associated with pleasure experiences, they stick around and you get much. In fact, one of the complaints is people that transition from oxycodone to buprenorphine, they go from Percocet to Suboxone. They're like, well, it's not working. We use it for pain also. And it's because they're not getting that experience of going up and down. And the other thing is with buprenorphine is it has a very peculiar quality in that it kind of also blocks the opioid receptor in the brain. It both steps on the accelerator and on the brake at the same time, whereas heroin and morphine or oxycodone, hydromorphone, all those, fentanyl, they just press on the accelerator. So it has a ceiling effect. So, and that's really important when it comes also to overdose, where you see the effect of a regular opioid, if you will, like oxycodone or something. The more you give, the greater the respiratory depression. So if you take more fentanyl or more oxycodone, you get more and more respiratory depression, meaning you're not breathing, you breathe less and less, and then you have an overdose. Buprenorphine is odd because the more buprenorphine that gets into the brain, it starts leveling off and it doesn't keep going up. So, but I hear this all the time. Oh, I'm not, buprenorphine, why? I'm just going to, go from one medication to, it's the same thing. I'm still taking opioids, and that's a really hot topic, especially with groups like NA and also with family members and even court systems. I've heard judges ranting and raving about how buprenorphine is no good because it's just trading one addiction for another. That's absolutely not true in the way it behaves in the trajectory of an individual on buprenorphine. And I'm not pushing it on because this is where it gets really very dangerous, because there are people that recover very nicely with abstinence. And certainly that could be considered to be the gold standard. That's great. So it's a touchy subject. I don't want to step on any toes, but anyway, it's complicated, and it still is.
Saves lives.
That's it. And I was going to actually ask Chief Campbell about that, utilizing buprenorphine in that treatment schedule that you have. Is this something that you're utilizing more and more, or increasing the use of buprenorphine in your space?
Well, we don't use buprenorphine anymore. We had a 3-month trial basis in which we used it on 9 different patients, and 7 of which were never transported again by us. So it has a lot of success and gets people back to work and gets them back to their lives. At least that has been our experience, and across the board, for the most part, it has very effective results. But unfortunately, we lost funding, and we weren't able to continue that process here. And we're working with Michelle Miller right now, and Cleveland Clinic, and several other organizations, including yours, to try to get this restarted and make a push to make it available more in Martin County, and that's coming down the pike soon, hopefully. But in our experience, it's been very successful, and 50, 60% of the patients who go into it have some form of recovery.
And we're finding that in combination with other recovery supports, that the individual does have that longer term for engagement and that longer term for success.
Absolutely.
And that's the goal, is to give them the opportunity, which is going to lead us to our friend Eric, who's created several opportunities. And Eric, first of all, welcome, and I know you've had a journey through drug court, so I'd like you to first describe sort of what that journey has been for you, and then we'll talk about some of the things that are happening now too. So if you could please tell some of your experience with drug court.
So my experience with drug court, it started out a little rocky because it was like my only option. unless I wanted to go to prison, which I did not. And so I chose that, and I fought it in the beginning, but then I realized that they just were trying to help me better my life, And the people at drug court are amazing. They will do anything. They literally bent over backwards to get me into housing and get me into places to better my life and to open myself up to being spiritual, and then getting me into aftercare, like outpatient facilities and stuff like that. And my experience too with what they've been talking about with Suboxone, I personally, I was on Matt for a long time, but when I got arrested, I didn't have that option, so I kicked that in jail, and I didn't go back to that. I stayed off of it. But I still believe, it depends on the individual, It does save lives, and each person's journey is different. So they need whatever works for that person is what they need to do for themselves, And in the end, if they wanna wean off and then get off of it, that's fantastic, I personally chose to abstain from everything, and through drug court, I became more active in the AA community. And DAA, which is Drug Addicts Anonymous, and I really like DAA because it uses the same literature as Alcoholics Anonymous, as opposed to NA, which is still a very good program, but I flourished in it and I enjoyed it, and then when I actually applied that to my life and actually started doing the work, like putting in the work, that's when I started to see the change in my life. And it wasn't so much me seeing the change, it was my family seeing the change and my friends seeing the change, and me not telling them, oh, I'm doing this. They were coming to me and saying, you're doing great, you look fantastic, so on and so forth. It's so nice to have you be present and hear and clear and concise all the time. And, I never thought that they knew what was going on, but they did. And again, like Judge Levin, Joanna Green, both, the whole drug court team, literally, they are fantastic. And, Joanna will even tell you, I fought it in the beginning, and, but towards the end, there's nothing more it literally changed my life. It's what started me on the journey to where I am now, and in the past 4 years, 3.5, 4 years, I have completely turned my life around, and I'm extremely grateful for that, and drug court is just a gateway, right? It's a gateway to open you up to new ways to live your life, to new ways to approach situations, and it helps you learn how to deal with things that happen, because no matter what, life is life. Things are going to happen in life, and one thing that I did learn through it is, a lot of people think that most drug addicts or people that are on drugs or in drug court, that's the problem. The problem, with me, was myself, right? And then I used that as a coping mechanism. You know what I mean? And that once I learned that about myself, then I learned how to replace that. I learned how to replace the hole inside of my body, in my soul. You know what I mean? And I did that by becoming more spiritual and through the rooms of AA and DAA. So, it's been life-changing for me, and I'm extremely grateful that I had the opportunity to go through drug court, and it also, as a benefit, it cleared my record, so that's a huge benefit for people, young people that get arrested. If they take that choice, they can get everything dismissed off the record if they complete the program and they just let the people at drug court help them. That's all they want to do, and people don't understand that, and I didn't understand it, but literally that's all they want to do, is they want to literally help you better your life, and they did a fantastic job at it. And I would not say I want to do it again, because I definitely don't, but I'm happy I got that experience, because it's been life-changing, so.
So now on the other side, and from the outside looking in, if you will, what would you say some of the bigger challenges in this community are for those that are newly recovered or seeking recovery?
Well, I mean, so speaking from my experience, there is a lot of cross addiction, right? So benzodiazepines seem to have come back in a very large way, and mixing that with fentanyl or other opioids, they're both central nervous system depressants, right? So, and naloxone or Narcan does not work against benzodiazepines, so it can be very, very deadly. The combination of the two. Sometimes you can administer as much Narcan as you want, but it won't bring the patient back because they are so depressed from the other drug. And there used to be like a saying, like, if you're not sure, go back out and try to do some controlled drinking, right? Because it was written in the 30s. But that's not the case today. There is no going back out and trying, because people are dying left and right, and I'm a native Floridian. I was born and raised here in Martin County, and I graduated high school in 2003, and probably about 60 people that I graduated with are no longer alive because they passed away from either drug addiction or suicide due to drug addiction. So, and it's only getting worse, like every day you hear and you see more and more people coming into the rooms, and they are getting younger, which it's a plus, because I started this when I was 18 years old, and I'm 38, so it was a long time, and when I was 18, there was no way I wasn't going to listen to anybody, but I wish I had, because it could have changed my life, and I could have started this at a much younger age. And that's pretty much what I see now. And also, I mean, it's great. They have a bunch of different events. They have a bunch of different cookouts, or they have something called Ficky Paw, which is for young people in Alcoholics Anonymous, and they do events all across the state, all across the country, and it's really nice. It's nice for people to get together, fellowship, and talk about their lives and talk about it. And you get to see the longevity of sobriety, and you get to see people that have changed their lives, and then you learn from those people, and you use what tools you have, right? And that's the people in the rooms or the people that I've met throughout this process, and I utilize all those tools. So any decision, anything that I make, I don't just make the decision. I pray about it. I talk to 5 of my very close friends about it. I have a sponsor. I have sponsees, and I make sure to discuss it with my sponsor, and I make sure to discuss it with other people. And by doing that, when I make a decision, I know in my heart I'm making the right decision, and it is it's kind of crazy how life works, a few years ago, I was beaten down and didn't think that anything would change, and now my life has turned around in a completely different way, and I'm going in a completely different direction, and I owe all that to drug court and to AA and DAA.
So one last follow-up. With all the resources and success you've had in your recovery, and this is amazing. That's why we do what we do, right?
Yep.
If there was one thing that this community could do to support the recovery community, one more thing, what do you think it would be for you?
It's a hard question, because there's
I don't give easy ones.
There's a lot of stigma around opioid abuse and drug addiction, So a lot of people don't understand it. So maybe more more learning or more more pamphlets or learning or something that people could like learn about addiction and learn how to address it, because an individual, right? So the way I learned it and the way it was taught to me is the person, you want to make the change. You have to want to make the change. You can't do it for anyone around you. You have to do it. But the best thing that could work in the community is just a better understanding overall of drug addiction. And that's why when I was asked to speak at this panel, I was more than happy to, because I like everyone else up here's perspective. I bring the other side of the perspective because I've lived it, and but what they're doing with the fire department, what the police are doing, or what the detectives are doing, it's amazing. What the doctor's doing, the outpatient, everything, that is just bringing more knowledge to the community, and the more town halls that we do about this will help curb this opioid addiction crisis, and before it gets too far out of control. Because it's gotten to a point now, where we just need to really try to, clamp down on it and stop it, because I'm tired of seeing the rest in peace post on Facebook and going to funerals. I mean, I will always do it, but it would be nice to see. It's nice to see the light in someone's eyes when they change, and you get to see that change in them. So that's probably the best way I could say it, is just the more that we could talk to the community and the more the community could learn from town halls and addiction, learn about it, that would help with families, it would help with loved ones, it would help everyone understand it better, and it would help the process go easier for the individuals that are dealing with the addiction.
Wise words. And Sheila, I was thinking about this too, and you mentioned this eloquently too, about families understanding. And at New Horizons, what are some of the resources that you're able to help with families? Because addiction, as we know, generally is a family addiction, a family crisis. What are some resources that people can come to New Horizons for, to support that family?
We have a lot of different programs for mental health issues. If the using is happening in younger people, we have children's services. I work with adults, and in my therapy, I will do family sessions with anyone and everyone that has a family member willing to come, and they're incredible. Watching the process when I have the opportunity to have a family member who's been hurt, they've been afraid, they've been worried, maybe the person stole money from them, or, any number of other things. And there's a lot of pain that comes in my door. And just being able to have that family member in there, give them a little education, let them know that the person with the addiction is not choosing to hurt you and scare you and take from you. They're very sick. It makes a world of difference. So I'm always encouraging people to bring in their partner or parent or, whoever will. So that's a big part of it.
And I think understanding too that when you talk about stigma, when they say the recovery community, or this is the community. People have challenges no matter what in the community, how we respond, how we rise up to that challenge. And you're hearing that from everybody that's here tonight, what they're doing in response, but also what is the result of that response. People say our lives are saved, and as Erica said, there's a whole new path. And that's one person, and I especially on this particular day, that when you know you've lost so many, and it is that pivot from, oh boy, losing someone else to, we've got one, we've saved another one. It's a change of tune, it's a change of heart. And Sergeant McCarthy, I was thinking in the law enforcement piece too, because you were, as you guys are doing your work and doing great work, when you encounter individuals, when you go out and encounter individuals in need, could you kind of tell the community your process, again, here we are having the drug court, but your goal isn't to arrest and jail and get people, incarcerated for substance. It's pretty progressive what they're doing at Martin County. Can you explain a little bit about that to the community so they understand how law enforcement is such a partner in helping people get recovery?
All right, so initially, when deputies, detectives, anybody working on the street, when we encounter people with minor quantities of drugs, possession level of drugs, our intent is not to arrest these people. Obviously, illicit behavior, they've committed a crime, but they're not the target. The target is the people who are distributing these illicit chemicals. And more often than not, we see the people that are distributing these chemicals, they're not users themselves. They are preying on people who suffer from these addictions, and they're reaping the monetary benefits of their addiction. So our end goal, obviously, is to get to that point. And I think what everyone has kind of shared in terms of this battle is not a singular battle. It's a community battle. It's going to take a lot of programs. It's going to take a lot of people coming together. I think that our benefit is when people want to help us. When we reach out to family members, we go to overdoses. We've been to overdoses before where we find out that family members have helped supply the affected victim with drugs. But our intent is to get them into the drug court program. So if you don't have, and I don't know how familiar everyone else is, but the way the drug court system works on the judicial side is there's certain requirements you have to meet. If you're a multiple-time convicted felon, you're showing a pattern of this behavior where you don't want treatment, your intent is not to be a simple end user but to distribute. Drug court's not an option. But we move forward and we work with the state attorney's office to ensure that the people that do qualify for these programs get into these programs. And we've had plenty of people, such as yourself, who have completed the programs, who have come back and helped us. They provide information to us to help us stop the flow of these drugs. Working with the state legislator, they actually revised the legislation for the distribution of harmful chemicals that have resulted in death. They changed that at the beginning of this year. It's actually first-degree murder now. Something that the Treasure Coast itself hasn't really dealt with in a while. The Martin County Sheriff's Office itself has never prosecuted a murder charge for the distribution of narcotics that led to the death. So far this year, we've now had 2. We moved to a grand jury a couple months ago and got a first-degree murder indictment, and we're about to move to another grand jury on a second one, both of which were chemicals of fentanyl when they came back from our criminal laboratory. So I think the big thing is the community support, getting help from people. If you have a loved one that's suffering from an addiction, reach out to us. We're not just here to come out and arrest people. We can come out and help provide you information to complete a Marchman Act, to force them, if they're not willing, to get the help that they need from all these people that are up here trying to help.
And I think for those that are watching us tonight and hearing from this panel, understanding that, especially in the last several years as we're dealing with this crisis, that the cohesion and cooperation between multiple agencies and multiple resources that's really making the difference. We have better chemistry on the positive side. That's helping. We have systems of care that are working together, and that also is making a difference. So what you're describing is how Martin County has chosen to respond to this by being a cohesive unit. And I think that's very important for the community to understand. And when we talk about how community responds, it's from top down and bottom up. So these are issues that the county commissioners, they take into account. They look at resources, our sheriff's office, our fire rescue, our Department of Health, our medical team, our behavioral health teams. None of it operates in a silo. So for those that are watching this evening, understand that this has been a process as well. Creating these systems of care has been a process as well, and this is showing the positive result of that. Now, within that, and quite frankly, this time flies by. This town hall is never long enough. But one of the things that we want to discuss too, there are some emerging challenges. You've heard about, they're moving the chemical needle back and forth when it comes to especially synthetics. And I did want to talk quickly with Dr. Kuchera. One of the emerging challenges we're seeing across the state, really across the country, is that we've had such success on the prescription opiate side as far as between legislation and legal lawsuits and the effectiveness of the PDMP, which is the Prescription Drug Monitoring Program, et cetera. We're seeing sort of a backlash to that, but we want to make sure we get out ahead of it. So, Dr. Kuchera, could you talk a little bit about sort of how that pendulum swung so far that we're starting to see some effect of that coming into this mix of need?
Yeah, these widespread efforts to reduce prescription opioid abuse mainly have focused on decreased production, DEA quotas, so they're not making the medications. Lawsuits, actions in the state of Florida, the $3 billion action against the distributors and the pharmacies for handling these medications. And the PDMP, or the prescription monitoring program, where you can check and see if a patient's getting opioids from different places. And actually, the problem there is there's actually legislation in Mississippi. There's a law that says if you see that your patient's getting opioids from another doctor other than you, you're bound by the law. I don't know, hopefully it's still not around, to discharge that patient in short order, 24 hours or 72 hours. So the real problem there is it's like pushing a person off the ledge. That's not the way to handle a person that may have become dependent on opioids, on the pain medicine. And we're seeing, the signal, the data is really clear. You see a 40% reduction in opioid prescribing over a 10-year period, and overdoses increased threefold. They tripled. And now, yes, that is mainly because of the illicit, the street narcotics, the opioids, like the fentanyls and the heroines. But overdoses from pain medicine itself really hasn't changed a whole lot. Now, it varies. California has had more success in reducing prescription pain pill overdoses. But, this idea that it's just rampant. There's this crazy disconnect between reducing a patient's ability to get opioid pain medicine and also supporting that individual as you say, we're not going to give you opioids anymore, but you have to do it in a very careful way that requires a lot of effort and a lot of support. And a lot of healthcare providers, unfortunately, are not doing that. They're happy to just stop the opioid pain medicine or reduce it as fast as possible. And if the patient then becomes unstable, and a lot of times they'll try and compensate by taking more of the lower amount to try and get back up. And then, unfortunately, what happens all too often is, the healthcare provider will say, "Oh, you're overtaking your medicine. You really have a problem." And rather than holding on to that person, keeping them in the practice, and trying to get them established in another place like New Horizons, which, by the way, has become an amazing partner in what we can do with our patients that have developed problems with our opioids. Anyway, sadly, we are just very interested in getting that particular patient out of the practice as quickly as possible. And that's kind of a national way of doing things. So we really need to support healthcare providers in retaining patients. We tried in the primary care space with your primary care doctor. We said, hey, please, why don't you prescribe buprenorphine? There was a huge effort since 2001 to expand the use of buprenorphine in primary care doctors. That failed miserably. And now primary care, nobody wants to write opioids. They're going to send everybody to pain medicine. The problem with that is there's 250,000 primary care doctors and there's only 5,000 pain doctors. So way overburdened. Everybody thinks, oh, it's going to be great. Just send the opioid pain patient to the pain doctor. The pain doctors are getting crushed right now, and we're saying, oh my gosh, we can't handle it. So out the door they go, and then they wind up in EMS. They wind up drinking, suicide, despair. It's not good. It's crazy. There's such a widespread idea. The politicians, they love to trumpet that they've reduced opioid prescribing. The VA system did a wonderful presentation where they said they took 850,000 veterans and reduced opioid prescribing down to 500,000 veterans. And I got on the microphone and I said, what happened to those people that you discontinued the opioids on? And they said, sorry, we don't have that data. So what happened? Suicide, 2022 was the highest year for suicide. I'm not saying that that's completely related, but if you look at the other signals, there's a real problem. And I wonder how many seizures of counterfeit pharmaceuticals we're seeing in Martin County, which is pain pills. So if you're a pain patient and you're getting Percocet from your doctor, and the doctor all of a sudden says, no, I'm not going to give it to you anymore, I've got cold feet, or you're acting a little funny or a lot funny, you got to move on. So the patient goes and tries to get Percocet, or, look what happened to Prince. He got a Norco, but it was made from fentanyl. So I don't know if we're seeing that, but that certainly is raising the stakes. It's a really dangerous place out there right now, and I don't think we're doing the right thing. And the state of Florida, we've got a huge destabilization of the opioid supply, and I'm trying to get the state of Florida, the Department of Health and the Board of Pharmacy and the Board of Medicine to kind of deal with the consequences, they're kind of getting collateral damage in their efforts to reduce opioids. We're seeing a lot of people can't get their opioid medications for a variety of reasons, but they're not getting the support from the state. It would be better to be injecting heroin on the street than it would be to be a pain patient who's getting cut off from your medication, because those pain patients, they don't go to New Horizons and they don't seem to integrate into the system. That may be a smaller number, but those people are very marginalized and they're in the shadows right now. So we're dealing with that particular population is really getting orphaned, and anyway, yeah.
Well, I think that's one of the important things for people to understand is that this is it's an evolving issue and an evolving challenge. A lot of the earlier, if we go back, say, almost 10 years now, the bigger first hockey stick rise in heroin use, especially in the state of Florida and around the country, was when we had the crackdown on the illicit pain clinics, not actual anesthesiologists and pain specialists, but the pill mills that were here. And it was known. It was a known side effect that you were going to have a return to. So we ride these waves. So I want the public to understand that what we're trying to do is, as these things come up, we're creating better and better systems to respond versus react. We have to have, it's a political discussion, it is a business discussion, it is a medical discussion, it is an education discussion, it is a faith-based discussion, it is an everything discussion. And it's important that all those voices are heard so we can hear, okay, this is a challenge, let's get the best heads around it and start making good decisions to mitigate that before it gets to, say, a fourth wave. Because that's what we're looking at, is the opportunity that you're almost creating a fourth wave in this crisis because of another population that's affected differently. And as we go forward, and I realize we're actually at that hour, unbelievable, that for all of our panelists and those that joined us tonight, this is the face of a community making a difference. This is the face of recovery. These are the faces of how we do things differently. We face a lot of challenges, and one of the biggest challenges in any community is this: unless this is in your doorstep or in your front parlor, in the kitchen, in your house, you don't know it exists, except for what you hear on the news, right? You're getting informed in different ways. But we are in a place now when it comes to mental health and substance use that either you are related one step to someone who has an issue or you know someone very close who does. It is the largest health crisis in the United States right now. And that's not to put a damper on the incredible work that's happening. If this was not happening, imagine the consequences of that. So today on National Overdose Awareness Day, the information that you all provided tonight is vital. The services you provide are incredible and so important. And my only word to those out there listening tonight is if you need support, you live in Martin County, you have the opportunity for that. At whatever level and whatever place your need is to get on that on-ramp to recovery, this county is here for you. And it's not perfect, nothing ever is, but we're there to make the difference and find new ways to do it if we have to. So for the 4th annual Opioid Town Hall, I thank you so much to our panelists that have joined us. Thank you for your time out there in Martin County, and we look forward to seeing you again for another update next year, same time. Thank you, everybody.